we have a pro bono clinic, so it's a free of charge clinic. It's for children and adults who are underinsured, meaning they don't have enough insurance, or they're uninsured, they don't have insurance. So even with the Affordable Care Act, not everyone can afford insurance. So people who have physical therapy needs come here, and they get everything they would get in a normal clinic, in a regular physical therapy clinic, except they are treated by students and supervised by a faculty member. But they get a full evaluation, a full treatment. They get fake billed, so our students get practice doing that, but we don't actually give them a bill. And it's a great experience for our students because they get to practice what they've been learning in class. They get to practice talking to patients. They get to see what it's like for people who aren't as fortunate and the healthcare needs that people have, but they also learn so much from the patients, from how to, just people's stories, how to interact with people. Some of the patients have been coming for a couple years, and so they can tell the students, like, well, that's not really how you do it, this is how you do it. So they really learn a lot. And we have seen that help as they go into real clinical practice. You know, when they go to a hospital or another clinic, people say, like, wow, they have really good skills. So it's a great opportunity, and it's a nice opportunity for those of us who volunteer in the clinic to get to know the students. You know, we all know our students very well anyway, but we really get to see them shine in here. They all have to do it as part of one class a semester, which is important for us because it ensures we have some continuity through the clinic. But what we find is that students, a large number of students, ask, can I come back? And we just are going to ask our administration if they can come back over the break because they really want to come and continue seeing patients. So we have students that come in the summer when they don't have to, come during their breaks when they don't have to. So I think they just see the value in it, and they see, you know, it's a great opportunity for them and for the patients. We have students that have pretty much worked all over the country. We have some students now that are working in California. We've had students that have worked in Hawaii. We have students that have gone overseas to do service work. We've had some students do traveling. We have had a couple students that went to pretty important facilities. You know, we have a couple students at Walter Reed. We have one student who's working at Walter Reed right now. Students that have opened their own clinics. We have several students that opened clinics in this area, but also in New York and New Jersey. So they're everywhere. One thing I am proud to say that is many people, especially in this area, because that's who I usually talk to, say, I can tell a student who's a therapist who's from Misericordia. So I can tell that based on where they've gone to school because of how they talk to us, how they act. So we're really proud of that. For a student who's thinking about going into PT, one thing I'll say is that it is a job where you can never be bored. You can work from people who are just born to people who are over 100 years old. And actually in our clinic we've had people from just a couple months old to someone who's been 100. So there is a gamut of people that you can work with and a variety of settings. You can work in someone's home, you can work in a school, a hospital, an outpatient clinic, you can do sports, you can do pretty much anything that health related that you would be interested in doing. So it's a great field where you can never be bored. You have to study hard to get into PT. So you have to enjoy science, but you also have to enjoy working with people. So, you know, if you're someone who likes science, but you also really want to make sure you have time to spend with people, this is a great field and you get to know people.
I like it just because the class sizes are super small. All of my professors always knew my first name. They see me in the hallway and they're like, hey Miranda, what's up? So that was something that I was looking for when I was deciding where to go to school, and that's something that I'm really happy that I got. I played volleyball in high school. My volleyball coach was actually a physical therapist, so I was talking to her a little bit about it, and I also coach volleyball now, and that was one of my goals. I wanted to be able to have a profession that allowed me to kind of have nights off and be able to coach and give me that sort of flexibility. And I've also always been into like sports and the human body. I took an anatomy class in high school and I was like, this is super cool. So I wanted to dive a little bit more into it, which is why I decided to do physical therapy. I would absolutely recommend Misericordia. I know we have a really great program here, and all of our professors just go above and beyond for us. Like, I wouldn't trade a single one of them for another professor. I couldn't imagine how they could do better. Originally, I wanted to do outpatient. I wanted to do some sort of like sport-related thing just because that's always been my background. But I don't know. They told me that things would change as I got into the program, and I'm gonna finish my first year in December. But I don't know. I am pretty sure I don't want to be in a hospital just because it's never really been my thing. But I'm thinking outpatient and probably a younger population. I don't want to come in knowing what I wanted to do. I sort of still have it in my brain a little bit, but I like to be open to the different possibilities. Just one of our professors said she works with like the geriatric population. She's like, I'm gonna try my hardest to make you all have a passion for that. So I don't know, maybe. I haven't had it in my geriatric class yet, but we'll see. And I also haven't studied peds yet, so I might love that. I don't know, I don't want to corner myself into something that I might not like and try to fit into there when that's not what I'm supposed to really be doing.